Let's get more now on the budget and how well the health sector fared. I'm joined now by Nathan Schlesinger, National Health and Wellbeing Leader at PwC. Thank you so much for your time. How does PwC assess the federal budget's health spending?
Hi. Look, I think health was always going to take a little bit of a back seat in this budget compared to previous years. There's just big cost of living issues, national security challenges, and coming off a budget last year where health got a lot of funding in aged care, $17.5 billion, mental health, $2.5 billion. Having said that, I think there's a lot in this year's budget which reinforces that we really are the lucky country when it comes to healthcare. The NDIS recommitted to be fully funded into the future, more access to life-saving drugs, more funding into mental health and suicide prevention. So, it's a real balance of, what we need to fund into the future, but what's already come. But I think ultimately, we feel as though our luck may run out eventually if we don't start to put more of a focus on some of the longer-term reforms needed in the healthcare sector.
Yeah, we'll come to some of the opportunities for improvement in a moment. Labor, in its budget reply, has pledged $2.5 billion for aged care. It would pay for a registered nurse on site 24/7, more workers, better food. Is that feasible? Is that amount of money enough?
Look, whether it's enough or not, people can debate. Is it needed? Ultimately, I think both sides have recognised the need to address the sorts of things that were in the Royal Commission and previous reviews into aged care. There's no doubt that we need more workers into the aged care sector. Research that we conducted a few years ago found that we would need 400,000 more aged care workers by 2040. So there's absolutely recognition, I think, on both sides that it's needed. There's also maldistribution of workers, but there are other things in aged care as well, which are going to be critical, lifting quality standards, increasing the amount of digital tools that are in aged care. So there is lots to do on aged care reform.
Do you need a Medicare-style levy to fund it properly?
There are many options you could look at to funding what we need to do into aged care. And I think our view is that it's not just aged care that's going to require those additional funds. You saw the funding that's required for the NDIS into the future. The prevalence of mental health is going to increase. That's going to need funding as well. And so our perspective is that we have to actually look at the cost of care in totality into the future. And what are we going to do over the coming years to actually reform so that we can afford care which is accessible and of high quality?
You touched on the workforce challenges in aged care, but it is a huge issue for other areas in health. How do you retain and attract staff, especially when immigration is low?
Yeah, it's a really big challenge. I was just today talking with some people about the medical workforce and the challenges with immigration constraints. This is a big issue for our country, and it's a big issue for countries right around the world. So from both an attraction and a retention perspective, it's really important. We're actually seeing more people wanting to come into the healthcare sector because of the pandemic, which I think is a bit of a surprise. You might have thought it might go the other way. But our workforce in health and aged care and others have been such heroes that I think a lot of people are looking to that profession now as something for their future. So that's positive. But yeah, we're going to have to work on new training places. We're going to have to work on ways to make regional and rural areas more attractive for people to come and stay and work. So there's big challenges ahead for us in health workforce.
Yeah, let's talk about some of the opportunities. What difference can a greater embracing of technology solutions make for the sector?
Yeah, so health has a huge opportunity with the digital agenda. I mean, health to some degree is further back than other parts of our lives when it comes to digital technology. If you think about the way we interact with our banks and entertainment and food. So there's great opportunities to make healthcare more centred around our particular needs through technology. And there's also great opportunities to connect us with the various healthcare professionals that we have to see, depending on what our kind of health issues are. And so we've seen a huge uptake in telehealth, obviously, through the pandemic. But there are opportunities to go even further, to use, remote monitoring technologies into people's homes so that they can look after themselves and they can interact with healthcare professionals without having to travel distances to go to hospitals, or even to better connect multiple healthcare professionals around a person's needs.
Sovereign capability we've had such a huge focus on that during COVID, and we're seeing investments, say now, in mRNA vaccine manufacturing domestically. What else is needed in this space?
Yeah, so, supply chains have been challenged right the way through, and so sovereignty around our own manufacturing of things like vaccines is really important, and it's great to see the investment in mRNA technology to be manufactured in this country. I think as well as that, and we saw this in the budget, there is a need to obviously increase the medical stockpile that we have, not just for this pandemic, but for future health shocks as well. And then there's obviously, opportunities to increase the production of other medical needs, be it for pharmaceuticals or medical devices. We do need to take a bit more control over the supply that we have for healthcare into the future.
Nathan Schlesinger, thank you so much for taking the time to break that all down for us.
Thank you.